Perfect. All right. Well, thank you everybody for coming tonight. We have MetroHealth Fellow Dr. Alarabia with us tonight. She is going to be talking about aging with spinal cord injury. It's become quite the hot topic within our community. More people are living longer, which is awesome, but we don't know much about what happens as we age. So, Dr. Al Arabia, I'll turn it over to you.
Yeah, thank you for giving me an opportunity to talk people with spinal cord injury about aging. My name is Dr. Dilshad Hunain Al Arabia, and I am one of the spinal cord injury fellows at Metro Health. I'll be sharing my screen here and see if that is visible to you all. Is everybody able to see now?
Yes.
Okay, great. So, and this is Metro Health or Brooklyn campus. This is our new campus, the Click Center. So let's go. So the topic of today's discussion, as already being told, was aging with spinal cord injury. And the learning objectives today would be to understand how people with spinal cord injury age differently from people without spinal cord injury. Understand choices you can make to improve how you age with spinal cord injury. And let's start first by talking what's general we have perception about aging. So it's an unavoidable part of human being, as we all know, but it's very common to have like no negative thoughts about aging, particularly like getting older means being ill, or older people are less physically and mentally active. There's also a myth which is like very commonly you might find people thinking about like older people have poor quality of life. So and then we do know that all doesn't hold true. Uh, it was very interesting to see. This is a cover page of a book which was on the aging myth. It is by Joseph Chang, who is a PhD, and the author goes in deeper to find what are the myths that are surrounding the concept of aging and the mysteries why some people look younger, even though they are quite older as their age. So it's available on Amazon if somebody wants to give it a read. So that's like one of the books, even just on the whole topic of aging, the aging myth. So why aging matters in people with spinal cord injury? Initially, back in the earliest days of the Egyptian era, when a person who used to have a spinal cord injury, it was thought that this is an ailment that does not need any treatment. And as per like as early as 2005 years ago, if somebody had a spinal cord injury, they were just given comfort measures. People used to die very early on in the period, very like early on in the acute period, as early as within 3 days. Some might die from complications like within 9 days, 12 days. And then there wasn't like any basic management being done, let alone the complications. So people didn't survive much after spinal cord injury. Uh, Initially, when there was not much progress or discoveries made in the scientific era. And then here is a quotation from Joel Michael Reynolds. He has extensive work and research work in disability. So he says aging successfully is not a question of one's individual will or effort. It is a question of such will or effort in intricate concert with a vast range of social, political, economic, legal, and other factors. So there are like a complex multifactorial parameters existing around in our society that might also affect our inner will of aging successfully. We do want to age gracefully, successfully, and in a healthy way, but then there are other factors that are so. And then we'll go over them in a minute. So this graph shows a comparison. It's a decade by decade comparison over almost 50 years. So if we start back in 1940s, a person who acquired a spinal cord injury at the age of 25 years was most likely, if you can see the cursor on this graph. So, if a person had a spinal cord injury at this point of time, let's say his age is like around 25, he might not survive longer. And it was very common to see people dying early on in the acute age, acute early onset period. And this is going in comparison with a person who did not have a spinal cord injury. So the uh, top arrowheads show the trend for a person, the mean expected life age, mean years for a person with non-spinal cord injury. And then the bottom, like the blocks here show as we go, like every 10 years, you see if a person who had a spinal cord injury was able to survive uh, slightly longer years. And then as you go down the road, like every 10 years, you see there's an increment. And then if you compare 1990 with that of 1940, so a person who was having like a spinal cord injury was able to make up around like 69 or 70 years. So that's what the advancement and with the proper health management and addressing the risk factors, complications, better medical treatment help survive a person with spinal cord injury long enough, which is almost close now to the person having life expectancy that did not have a spinal cord injury. And then this shows like a complex interplay of multifactorial factors that affect how we age. So there are certainly biological factors, which means medical complications, medical conditions, having multiple comorbidities, uh, on multiple medications, physical health that's affected, which kind of like interacts also how we think on overall how our mental health is. So our coping skills, how do we look at ourselves, and the family relationships we have, social skills, which then also, as you see, there's like a significant overlap in all of these three with the social setting as well, which is the peers around us, family circumstances, and social issues, how things go around us environmentally. So these all affect how we age and impacts our overall quality of life as well. So this is another comparison of a person with and without spinal cord injury. So if our health reserve, the reserve capacity drops down to 40%, which is the horizontal line. And then if you compare the downslope trend, spinal cord injury versus non-spinal cord. So you would see like a steeper curve for the person with spinal cord injury, because definitely at baseline we have a spinal cord injury with weaker immune system and a range of complications in different organ systems. So that's very like a vulnerable point or at risk when we have certain kind of diseases. So we might not be able to cope up with like the recovery period as fast as a person without spinal cord injury would. So this is just to give an idea how things are different for a person with spinal cord injury versus without spinal cord injury. And in general, you might have come across definitely all throughout your life. There is a group of physicians who are basically generalists. They definitely go through the medical school education, and then they have the residency education. They do have clinical experience to manage patients with the general comorbidities. And but overall, what separates them for patient from the physician population that specifically deal with spinal cord injury is overall, they do have little number of patients with spinal cord injury in general during their clinical practice. So what happens is when you go like specifically to person with spinal cord injury, he or she has some more expertise regarding dealing with your muscular weakness, the sensory loss, autonomic dysfunction, autonomic dysreflexia, breathing problems, bowel and bladder, managing with your wounds, weak bones, thin bones, and then the infections which are very common in the spinal cord injury population. So this is like a good bridging gap, and then they help you connect you back to the primary care physicians and general surgeons as per need. But then certain group of physicians that typically uh, take care of patients with spinal cord injury in a very specialized way are called SCI specialists, and we work together as a multidisciplinary team, and then we work in collaboration with the entire healthcare network. So, moving on to the top 10 causes of death in patients with spinal cord injury. So, I find it very interesting to see if you compare like with the general population. Patients without spinal cord injury in general, the most common cause of death would be number one, cardiovascular disease, followed by cancer, and the third number, the most common cause is trauma or accidents. But if you see the number one and the most common cause of death in patients with spinal cord injury, it's the respiratory system, and the most common being infection, which we all know as pneumonia, almost 65.2%. And then second most and the leading cause is infections, which is very common to have from infections in the wound, probably in the lung, in the form of a UTI. So, infection being the second most, and the third is the cancer. And here, I like to highlight bladder and prostate because, in general, if you see the trend, so it's common in the general population that the lung is followed by colorectal, the colon cancer, followed by the liver cancer. But here in patients with spinal cord injury, typically have prostate and bladder higher up in the list, and which is like very different from the general population. And then these two further highlighted causes of death in patients with spinal cord injury are the unintentional injuries, which were not intended, but then it resulted in death, and then suicidal also one of the common causes of death in patients with spinal cord injury. So, starting with the breathing problems first, it is the most common cause of death in patients with spinal cord injury. So, overall, we all know breathing muscles are weak in patients with spinal cord injury. So, the higher the lesion or the higher the level of injury, it's more likely that it will affect the breathing muscles. And there are small airbags in our lungs which cannot open up all the way. And that does affect the gas exchange as well as the secretions, which, if get lodged into those little airbags, will form mucus plugs and will not be able to drain through the breathing tubes. And it can also result in airways that can like spasm and be closed there. Overall, the immune system is weaker, so we are more prone to infections. Could it be bacterial, viral, leading to infections? And then there's a condition called sleep apnea, which is stopping of breathing while you're asleep. So momentarily, for few seconds, you or somebody might tell you that they have seen you not breathing at all, maybe taking pauses during sleeping. So that affects the how oxygenation occurs in your lungs, and it also affects overall. And then we'll talk bit about it in a few minutes about sleep apnea and increased body weight overall. So, in addition to what we have discussed, increased body weight, a person who has higher BMI, loss of upper airway muscle strength, having a deviated or crooked spine or scoliosis, and overall nervous system wearing down all make it harder to breathe. So this is just a pictorial representation of what I just discussed. So the top here is a portion of the breathing tube, which is clear. But then if it gets lodged with a mucus, which are the secretions, and if they do not get drained, these are nidus for infections. And this is just another small air sacs or air bags in our lungs. And if they get lodged with these secretions, over the time, it can develop a fever or growth of bacteria and then finally can result in pneumonia. So, patients or people with spinal cord injury who are complete quadriplegic are at highest risk overall. But as we age, like physiologically, anybody without spinal cord injury would have, in general, like a decline as we age, normally physiologically in their breathing capacity. But it's also important to remember that a person who was initially quadriplegic and he might not be needing any additional breathing equipment maybe, or never had a trouble breathing in the earlier years, but as he or she ages, he might or she might need the support of additional devices or equipments, or maybe might need a ventilator later on in the life because one, we have a spinal cord injury that's making our breathing a bit weaker as compared to like people without spinal cord injury, and then there's a physiologic effect of aging as well. So it's also from the past, if you see if somebody has like frequent infections, if somebody already has a COPD, any lung problem prior to spinal cord injury, that also adds and puts him or her at a more risk of having breathing problems later in life. And you might have heard and then have come across the discussions where your healthcare providers ask about your immunization or vaccine status overall. So it's very common for patients with spinal cord injury where when on annual exams, we ask about your pneumococcal vaccine or having vaccinated with an RSV vaccine, which is another very common viral illness caused by respiratory syncytial virus. And every year, based on the CDC recommendations, that's the Center for Disease Control and Prevention. They have recommendations for immunization, and the recommendation for the last year was everybody above 60 years and above should be getting an RSV vaccine. But then the recommendation for this year is everybody who is 75 and above should be getting an RSV vaccine. And then those between 60 to 74, if they have additional risk factors, maybe they have like a heart disease or a lung disease, or patients with a neurological condition that have like an affected respiratory system, which we, in our like medical term, we call it as a neurogenic or respiratory disease. So those are recommended to have vaccine just once a year. It's not an yearly vaccine. So if those who have got last year, they do not need to get it every year, but it's just a recommendation that to get it before the peak time, where it's very common for the RSV virus to spread in the communities, and that's late summer, early fall. So that's for the RSV, and then for pneumococcal, we do have it's basically for the providers like the physicians. They can see if their patient is due for a pneumococcal vaccine based on what type of serotype vaccine they had it in the past, and it's usually every 5 years. It's recommended to get your vaccine or immunization status updated if you have not got one. So, what are the warning signs of poor breathing? Unexplained shortness of breath, breathing faster than normal. You might experience or heard about somebody experiencing daytime drowsiness more often than usual, fatigue, varying mental status. And if you find there's a big difference in breathing, while you are sitting than while you're lying flat. So this could be or other signs that could indicate that you might need someone to give a systematic review of like clinical evaluation if there's something concerning. And here is a comparison of like two X-rays here. You can see the black area, which is lung. And in the next picture, the second picture, you can see the right half is totally almost like vanished. And then what happens is the next day, if you can see, the both sides are clear. So what happened here? At this point, there was a rapid improvement with cough assist. So, and this we already like go over mucus plugging in the previous slides. So what is cough assist? It basically helps keep the lung air sacs open and removes mucus from your lungs. And normally, if I want to cough, I would take a deep breath in, hold it for fraction of second, and then try to push everything out so that I can clear up my airways. So this device helps you to push the air in for you, and then would pull out the secretions or the mucus just like a vacuum. So and on an in breath to open up the air sacs. And here you can see he's a physician from Kessler Foundation, and he is demonstrating the use of a cough assist. It is basically with a digital display and a pipe which has a mouthpiece. Some equipments might have air mask with it. And this is just another, just a pictorial representation of how it looks like. It's slightly an older version. We do have now one with the digital display, and it has the equipment which is connected to it. So it helps clear your airways and secretions. And this is how it looks, the oxygenation or aeration is affected when it's blocked with secretion, mucus, debris. And then if you see the cleared up side, helps better aeration and flow of air within the lung parenchyma. And so overall, how can you improve your breathing? So we have certain recommendations like ask for a cup assist equipment if you have trouble coughing up your phlegm. Learn how to do your manually assisted cough techniques if you do not have like a equipment or device. So there are certain manual techniques. And then get vaccination for pneumonia, influenza, COVID, and respiratory syncytial virus. Stop smoking and do not start smoking. And ask to have your breathing function tested if you think there are certain problems in your breathing or trouble coughing. And then getting a sleep study is another type of a test which helps determine if you are having a sleep apnea, which means you might be snoring more at night. Somebody might tell you they have heard you snoring. You wake up with headaches. You might feel tired and fatigued. You do not wake up rested in the morning, and you fall asleep more often during the day. It's normal for some people to take a nap, and that's fine, but like sleeping more often on random times. And then you might just think that I might take a nap for a few minutes, but then when you wake up, you have been sleeping like a couple of hours because you haven't been able to sleep well throughout night. So that's how the features are for sleep apnea, and then sleep studies can help find out if you have one. So so there's like another machine you might have heard about, CPAP, and that can help you breathe during the sleep when you have like a weaker reflex of breathing when you're sleeping. So some people like find it very difficult to keep it wearing on during the night. So one recommendation would be to try wearing for like shorter periods during the day. And then if you have some problems like fitting and with the mask, or you think that's not comfortable with you, so you can ask help from a CPAP technician, and he or she can help you with your mask and overall help you with the practice as well. So this is how it looks like, the machine by your side while you're sleeping at night. It definitely looks uncomfortable, but then giving you good sleep through the night with good aeration, good oxygen throughout the night would definitely help keep away the symptoms which we just discussed and definitely affect your overall health. And that's another very important topic about the antibiotic resistance. It's very common to have infections once you are having like a spinal cord injury, and down the road you might have like a wound, you might have pneumonia, you might have an infection in your urine. So the most common being a UTI. So the reason we are very much anxious and worried about the antibiotic resistance is we do not want to run out of options of the antibiotics. And what we can do is it's very important to know that certain bacteria or having a bacteria in your body does not always means that it needs treatment. So certain people might have bacteria which are like colonized within that area, which means they are still lying there, but they are not causing any problems. And it's just like you have a house, you have a couple of rooms there, and you are living with a roommate, but the roommate doesn't pay your rent, and it's he or she just staying there and doesn't is not causing any harm. So you might think of just letting him or her stay, but then once after some time, if that particular person starts to like create problems, drilling holes in the wall, or maybe calling random people to stay there. So you might want to think of um, asking the person to leave. So that's kind of like analogy. We can help explain once we want to know what the good bacteria or a bad bacteria would be. So technically, like a good bacteria would also provide you with some benefits, but if the bacteria is lying there for a long time and then it has like become part of that area, we normally call it as like a colonization of that particular area, and then we also want to see if that bacteria is causing any symptoms. So having a infection in your urine does not always means that it needs treatment, because if you have symptoms like fever, having increased tightness, spasticity, having autonomic dysreflexia, more urinary leakage or accidents, vague abdominal pains. So these are the symptoms which are not always there, and then once you become symptomatic, then that's justified to treat your infection. And if somebody who is, excuse me, on an indwelling catheter, so it's very important to get the catheter changed. Do not send the sample from an old bag or the collected sample of urine, which is lying there for more than 48 hours. So because we do not want to get false results, and we want the proper treatment if that particular bacteria is the cause of your UTI symptoms. And it's always recommended to send the sample as soon as possible, but you can save the sample in a refrigerator if that's not possible to send the sample right away for almost 48 hours. And then moving on to one of another major systems in your body, and that's cardiovascular system. So what happens to your heart and blood vessels after spinal cord injury? So basically, just some basic and general information. It's very common in patients with spinal cord injury to have increased risk for cardiovascular problems, heart attacks at a younger age, and then having low levels of good cholesterol, which is technically called as HDL. There's a three times increases of getting or being in the pre-diabetic range and developing diabetes. And then there's a concept of having more fat mass versus the lean body mass, which is the mass contributed by our muscles. And then there's a certain portion of your body which has a contribution by the fat. So the fat component increases and the muscle component decreases. So that's also the normal changes with the body undergo after spinal cord injury. And these are some of the symptoms you or almost everybody of you might be knowing about it. like commonly it presents with chest pain, chest pressure, squeezing sensation. You might have a radiating pain, or people telling about indigestion, nausea. So it's very interesting that in patients with spinal cord injury, the pain component of a symptom of with a symptom of heart attack might not be very evident, and it's always almost because people with spinal cord injury having like a level above T5 may not feel the heart pain usually like other people do, because the supply of the pain perception is at that level, and then if the level is compromised, so definitely you cannot feel the pain. So one might feel like a shortness of breath symptom, nausea, might feel like fainting, having an unexplained autonomic dysreflexia where you cannot exactly pinpoint the cause, and then having increased spasticity could also be. And even like for the cardiovascular system wise, if you uh, see patients like chronically have leg swellings, and then it's very difficult to differentiate if it's like a clot which is there within the leg vessels that's causing it, commonly known as DVT, or if there has been like a clot lying there for long, and then it might be evident once the wound developed there. So it's very hard to differentiate, and then it can be easily missed. And moving on to like an additional component of like weight gain, cardiovascular problems, we have diabetes and obesity. So two-thirds of persons with spinal cord injury are overweight. Based on the statistics, and definitely being overweight increases the risk of diabetes. And then why are we worried of the obesity versus diabetes? Because overweight and obesity puts you at a risk for getting diabetes, and then diabetes has multi-organ effects affecting our eyes, kidneys, our vessels all over in the body, our brain. So it has a multi-system effect, and this disease can affect like almost every part of the body. So it's very important to avoid on and then keep it under control if one has. So any person with spinal cord injury and a new diagnosis of diabetes has already it's based on the literature. It has been found out that almost one fourth have already the eye problems, which means diabetes has affected already their eyes. And then out of every like 10 people, four might have wounds, especially like commonly it's seen in the foot, developing foot ulcers, which might require very, very long periods of healing, and that can affect you in different ways. So, what do we recommend is getting your annual exam every year. Obviously, blood pressure checks, your cholesterol test, testing for diabetes, keeping your weight under control, avoiding tobacco use, keeping your activity level within the recommended and possible um, ways, avoiding alcohol use, and then reviewing your medications, avoiding medications we do not need, and then being on medications that are helpful for your overall health and comorbidity. And it's also important while you are definitely recommended for exercise and healthy routine. It's also important to avoid overuse injuries, because we always want you to preserve what your residual muscle and joint function is, because having repetitive exercise and then working with your joints in an inappropriate way will definitely cause more problems. And then like being trained or following an exercise program by a certified inclusive fitness trainer is also very helpful. So having some discussion about gut here. So normal aging does affect the gut as well. Not only just spinal cord injury, our normal aging as we age, the gut function, the overall GIT function, the gastrointestinal tract is also affected. So we do know that as we age, and also with spinal cord injury specifically, uh, the food moves through the gut very slowly. So just to give you an idea and the comparison, for a able-bodied person without a spinal cord injury, he or she might have a poop. or having a colon transit time within 24 hours. So he or she might be eating something and then might feel the need to go for a bowel movement within 24 hours. But if you compare that with a spinal cord injury, that might take as long as 72 to 90 hours. So almost like 3 days for the gut to keep on moving that food bolus and then helping it reach to the point where you finally or the body's ready to have a bowel movement. So it's very slow, and then with aging it also gets slower, and it's a part of normal physiology that with aging we have less acid that's produced in our stomach, and then as the food or the food condense moves slower in the gut, it absorbs more water, which means harder and drier stools, which definitely would end up and be as an experience of constipation. And definitely we do not want you to have a constipation. So number one, so that you do not have accidents at unpredicted time. And definitely it would also be in some cases lead to autonomic dysreflexia. Some people, after trying lots of options and different bowel care regimens, at certain point they go for a colostomy. But for some people, it's the choice very early on in their time period after spinal cord injury, because it reduces the time needed for bowel care. And also always important that like every person in the general population, patients with spinal cord injury also do need to go for a regular colon screening to see and keep an eye on the colorectal cancer, which is still a risk for like everybody it is. And this is just a picture showing the healthy stoma, which is the end part of the healthy gut. And it's attached, the contents like empty into the bag, and this is how it looks. So it's pretty much covered under the top or the clothes, and it's almost always never visible. So how can you help your gut health? So do bowel care daily or every other day. That's what we recommend to our patients. Try to avoid taking laxatives. So it's not always that a laxative would help you. So I've seen patients, some people have preference to use or consume prunes, and that helps them a lot. Some try to eat like more fiber and through fruits, vegetables. So everybody has a preference, and for some, definitely laxatives are an option. Then also keep up with diet and fluid intake. Keep yourself as active as possible, and consider colostomy if having repeated episodes of incontinence that's affecting your quality of life, having repeated episodes of constipation, or having autonomic dysreflexia, or the bowel care is um, somebody's not there to provide, or person does not have a good hand function to do it themselves. So there are different situations. And then definitely treat hemorrhoids and get your colon cancer screening on time. So the general recommendation is everybody between age 45 and 75, especially people who are from African American descent, are at higher risk. It's been seen in the literature. And in general, anybody after age 75 might also be needed to undergo colon screening based on what the results were in the earlier screening reports. And some people might have some polyps, which the physician wants to keep a track and monitor them over a period of time. So there are certain exceptions, of course. So even after age 75, you might need to undergo colon cancer screening, and that's as a preventative health measure. And so let's see how normal aging and urination is, and how is it affected in spinal cord injury. So overall, bladder capacity is affected definitely based on how or what type of symptoms you are having after spinal cord injury. So some might have very overactive bladder, while other might have very bladder that is very not so much responsive, so it keeps on storing a lot of urine. So that's just based on the type of bladder we have after spinal cord injury. So basically, there are two types of bladder, and as we said, that more bladder contractions can be experienced. Overall, if you see physiologically, everybody, even with a good, healthy kidney function, will have like a slight decline gradually over every 10 decades after the age of 40 or 50 in their kidney function. And as we age, we do have increased risk of urinary tract infections, especially after age 60. Women are more likely to have stress incontinence, while men experience retaining more urine when they pee, particularly with prostate enlargement. And that's part of our normal physiology. And overall, earlier it has been documented that urinary tract problems used to be the number one cause of death after spinal cord injury. And now that number is much, much lower due to active monitoring and appropriate treatment of urinary diseases. And we definitely want to keep this number low. So the recent statistics was a urinary disease was the cause of death in only 3 people out of 100 um, from the 2020 data we had. So it's common to have or see people with stones occurring in 1 in 10 people after 20 years of living with spinal cord injury. One of the most common causes of hospitalization is UTI and bladder cancer, as we talked earlier in the slides, where we talked about the most common causes of death. It had bladder cancer and prostate cancer earlier, higher up in the list. So it's usually overall very rare, but it's more common in spinal cord injury population versus the general population. It almost takes about 20 to 25 years to develop, and that's most commonly and more associated with the use of Foley and the suprapubic catheter, because that's a thing from the outside world that keeps on like um, you might say rubbing against or having in contact with the foreign body of and our organ having contact with the foreign body, definitely over a period of years and years, might be affecting the general health of the epithelial lining inside these organs, and might lead to cancer after so many years of being on them and using them. So the genitourinary recommendations are to undergo a yearly screening for kidney and bladder stones and to see if there's a kidney damage. So for that, we have annual ultrasounds, might not need the need for a CT or a CAT scan, and some blood work for your kidney function. It's also important to know what your symptoms of UTI are, because some people have very specific symptoms of UTI, and every time they have a UTI, they have those same set of symptoms, and they can very quickly recognize if they're having a UTI or not. So as you age, as time passes by, you might be knowing your particular symptoms that might be different from somebody else's. So even some people just feeling fatigued or tired would be their first thought would be that probably I'm having UTI, because they have been experiencing that very often. And then for most of the time, they are correct. So evaluate and get your evaluation done for a bladder program annually. And then also important to avoid overfilling your leg bag for those who are on indwelling catheters. And it's recommended for women to use the smallest possible size of the catheter, and definitely avoiding smoking because it decreases the risk of bladder cancer. It's important to notify your doctor if you have a blood, which is not a part of like regular changing your catheter for those who are indwelling catheter, or if it's a new observation. So it's important to notify your physician. Also, he or she might need you get worked up with procedure called cystoscopy, which helps you look inside the bladder, and some special kidney tests, or they might send some samples for the analysis. So this is the top left picture shows how the bladder looks from inside, and this is how a cystoscope goes inside and then is capturing the visuals from inside the bladder. This is how like the CAT scan, the usually what we have this set up for an MRI or CT scan, and this gives us a picture or idea about even like small fragments of stones lying there, if they're causing any obstruction. So that might be of help and important to evaluate your urinary function and your kidney damage. So, what typically happens as we are proceeding with our overall effect of aging system wise in a patient with spinal cord injuries? So, the next system here is effect on nervous system. So, as we age, we have a protective lining around our neurons, which is called myelin. And this is just the pictorial representation of how things change as we age from a child, an unborn, to a newborn, and then a child with young adult, teen, and then adult. And then as we gradually age, with like the old age, you can see the shrunken size of the brain. And this is on a very sophisticated imaging, how the young brain looks different from the elderly brain. So definitely the nervous system also undergoes changes. And overall, the strength declines, our reaction time increases, the ability to perceive, even with the tip of the hands, we have some special sensors here which help our nervous system to judge how things are around in the environment just by touch and having different perceptions are all helpful for our nervous system to function that gradually decline as we age. So this kind of like shown by the slope here. We have mechanical receptors, and overall the circulation is also affected. The microcirculation, the small vessels which supply these nerves all over the body, the network of nerves we have. So it definitely affects all our balance, our ability to do like things in a quick sprint. So it's overall physiologic decline. So it's very excuse me seen with patient with spinal cord injury almost like after, if we see every 6 patients out of 10 would have a complaint or an associated symptom of related to a nerve compression in our peripheries, which is around the wrist. It could be around the elbow. That's most commonly. So you might have heard about your median nerve compression being evaluated or discussed in the clinic, or compression of the ulnar nerve at the elbow. So most commonly, initially, the conservative measures like splinting can help, and other options based on the severity of the nerve compression. So, surgical options are another mode of treatment. So before going for any surgeries or procedures, it's also important to see how much would the recovery time would be, and then if somebody is totally relying on the upper hand function, and then the person or the patient is asked to give the hand a rest for some time. So how would he or she be ambulating around or moving around? So is that the time when you need to shift to a power chair, or is this the time you might need more home health aides, or temporary might be moving to a nursing home? So it's always important to plan how the recovery period would be and how long would that be, and what would be the precautions before going for any surgeries which you might be offered for uh, such medical conditions. And then years and years after initial spinal cord injury, especially seen in traumatic spinal cord injury, more so, some people might develop a fluid-filled cavity within the spinal cord, and that rapidly changes how the function changes. For example, some might experience were stable from years to years, and then all of a sudden they start to experience like a decline in their hand strength, or feeling more numbness, tingling out of usual. They do not have like any peripheral nerve compression. They do not have any new trauma, no new medications. But then gradually, over months and months, they start to experience new symptoms. And some of that might be related to having new AD, like autonomic dysreflexia, or having more spasms, even though the previous, like the symptoms were controlled on your usual oral antispasticity medications, or even just having pain, more pain above the level of spinal cord injury. So it's always very important to discuss with your doctor if having symptoms, and surgery may be an option in cases where it's important to intervene, depending how, depending on what level it is, and then if it might be beneficial or not. So it's worth discussing. So annual exam, annually, like getting your neurological exam done, like the strength testing we do for your upper limb, lower limb, and then getting a good idea about the light touch and the pinprick overall for all your four limbs and the chest, the usual protocol we have for basic exam. And then also getting your peripheral nerves evaluated. Most commonly, it's median and ulnar for patients specifically who are paraplegic, who have more hand function and have been using it for a very long time and are dependent on it. So that's very, very closely related to your musculoskeletal system as well, because good neurological function in your upper extremities definitely will make you like be able to do things with your hands, with your upper limb. So it's very common to have and like upper extremity overuse. Very common to see some shoulder pathologies. Arthritis is part of the normal aging, which is like a wear and tear undergoing in certain parts of our body or joints. Fractures because our bones are weak. We are not moving around much, and then that's like not of much load applied to our bones, and then that's how like our bone. The physiologic cycle is not the way it is in any other person without spinal cord injury. So they are more prone to like fracture or breaking bone with like a very trivial trauma. And then osteoporosis, which is your weak bones as you age. So people usually lose one third of a bone mass in the first 16 months after spinal cord injury, which is if a person who's very young and had a spinal cord injury. So they might lose their bone strength and its strength and overall health overall very early on, because the ability to ambulate is quite affected. So it's very similarly affected in person with who is like aging, and then it's undergoing those physiologic process. And half of people with spinal cord injury have pain. So it's very common for people to have or experience pain, like shoulder pain and the wrist pain, and that could also be because not performing activities or like appropriately, or maybe loading unloading at a joint which is biomechanically not so appropriate, or is causing more harm than benefit. So with supervision, with more guidance, that can be managed. And this is how like a aging spine looks with you might have heard about the osteophytes or the bony spurs which grow around the end plates of our vertebrae. And this is how like a shoulder with repetitive upper body use, most commonly for propelling your manual wheelchair. And then certain times it's not our bones that are affected. Sometimes our soft tissues, like our tendons, which are around the bony area, the joint area, which help support movement for that particular joint, are affected because they are undergoing repetitive cycles of inflammation. And it was previously it was very common notion to believe that if you do not use certain parts of your body, you have to use it, or otherwise you would lose it. But it does not hold true anymore in this era, where we want you to avoid overuse, and then we want you to preserve. what you have at the baseline. So we want you to move in ways that conserve and preserve to reduce damage to the upper limbs and joints and protect your shoulder function. But we also want you to be active, and that's always like a balance, and without having like the balance tipped over to having like more problems. So be aware of your fracture risk and prevention. Watch your feet and legs, and also it's never always that a sign of fracture would be like a bent bone, or it would be something very evident. It could be something very minor, like just a swelling there, or just a bruise there, or just an area of warmth. You might have a fracture or broken bone beneath it. So it's always important to pay attention. So overall, do your shoulder stabilization exercises, which means keeping your muscles in a healthy state, so that if they have to work a lot, they should have like a good strength. And then resting upper limb is usual for like a patient without spinal cord injury. They might take some rest for a while, as long as they want, but it's not easy for a person who is dependent on his upper extremity function and is a realistic, especially for a person who is a manual wheelchair user. So we recommend like activity modification rather than going to a complete rest. We could have modifications like getting a lift assist. It could be a lift which is back to the ceiling, or gantry or floor based, so that you do not have to totally overload your shoulders or your upper body. And then for some time, you might need to reduce your car transfers and then think about using a minivan for that period of time when you need some rest or you are in your recovery period. So you might have heard about people undergoing like or being recommended for shoulder surgery. So overall, it's important, like for any procedure, it's important to plan and know how much the recovery period would be and how much benefit it has versus the outcome being not so much that you expected. So it's different for everybody. And very long period of non-weight bearing would be definitely detrimental to you as well, overall in terms of quality of life. It could be as long as 6 months. So it's always good to like plan your time ahead, that you might need additional help in that period of recovery if you want to go for a shoulder surgery and if that's needed. So just like moving yourself to the use of a power wheelchair, getting some training with the use of it, and then discussing with the environment, your family, and the caregiver support you have. So it's always important to plan things ahead. So similarly goes for your skin. It's a part of normal aging for the skin to undergo some changes. It's very common for people with spinal cord injury to have pressure injuries. So the general physiology is the skin becomes thinner and less elastic, so it's prone to break down. Overall, the circulation is not so great. We need to have times where we need to offload our dependent areas so that we can allow time for circulation to flow back, and then avoid pressure wounds or injuries. And then definitely decreased mobility reduces the opportunity to redistribute the blood flow to the weight bearing areas of the body. So the first step, what we tell to, like all every patient, which whenever we talk about your skincare, is prevention is the key. So doing adequate pressure relief, which is always whenever you are sitting, it should be 15 minutes for about 2 minutes. uh, every 15 minutes, you should be doing a pressure relief when you are sitting, and that should last for 2 minutes. And then if you're lying down, it should be after every 2 hours. So changing your sides is always recommended. So proper positioning and posture uh, plays a key role. And for chronic pressure sores, it's always also important to monitor for infections. Always good to have a good nutrition so that it helps you to heal your wound better and earlier and faster. and definitely prevent excessive moisture around that area. So keep that area good, aerated and dry. Get the right support services and equipment to allow you to do good regular pressure relief. So you might need some modifications in your chair. You might need a specific seating system to help you prevent the pressure development of pressure injury. And overall, if you see the independence curve, so people who are under 60 years of age, almost like 60% are independent for most of their care of self-care needs. But as you age, it's a part of normal aging. Even a person who is not having a spinal cord injury would be dependent in some or other areas of self-care. And that's okay to ask for help. And it's almost always our priority to keep ourselves safe and then avoid things we can avoid like falls and then overloading our joints. Taking help would definitely help preserve and stay away from more problems. So it's always a good question as we age to ask ourselves and then be aware of the outcome, that when it's time to transition to a power wheelchair, or when it is time to switch from a car to a wheelchair accessible van or minivan, or when to start using home health aids, and then when to stop doing own transfers. I know there have been people who have been doing their transfers, their all activities of care for years and years, and they are excellent at it. But we should be listening to our body also. Sometimes when we age, there are certain signs, there are certain systems of our body that need attention. For example, somebody might have like more soreness than usual, which was not very common when they were young, or their joints get sore too quickly, they feel tired. So it's always good to think over different options if we have like alternate, and then that can help us with our independence. And I always see an injury, it's not just a process of recovery, it's a process of discovery. So as you age, you discover yourself overall, you know what's the best for you. You might not be told by someone who has been seeing spinal cord injury for the last maybe 20, 25 years, 30 years or more. But then, if you yourself have been experiencing, you might come up with solutions that nobody have ever thought about, or that is working best for you. So it's always every day is a different day, a day to learn and discover yourself and the things which are best for you. And you are never too old to set another goal or to dream a new dream. So if things change, and you need to do things differently, so it's okay to change your path and do something else which you can excel. So I have seen people and read about that people who were doing their like they were excelling in every walk of life, and they were totally in like a different field working there, and then after spinal cord injury they changed it, the life changed and their functional, their capability changed, and then they discovered that they can also do something else which they can even excel in that specific field, like person who was initially a very talented software engineer, and then after spinal cord injury he never knew that he could paint so well, and he was a great artist as well. So sometimes it's good to have new goals, and then dream new targets, and then work to achieve them. So this is the book title cover of a book which says Wheeling and Dealing. It's by Esther Isabel. And then it has 32 in-depth interviews of people who have experienced different stages of life and what they experienced, how their experience was, what was um, the hurdles in their life, what worked best for them. So it's a great book if somebody wants to give it a read. It's also available on Amazon, and it touches like every chapter of life, from friendships, relationships, employment, self like your ability to cope up with stress, your mental health, networking, marriage, services they had throughout their life. So it's basically a compilation of experiences which people had in their real life, patients with spinal cord injury. And the take home message would be people with spinal cord injuries are living longer, as we already saw in some of the data in our earlier slides. So you need to find ways to promote and maintain your health throughout your lives. um, it's also important for people with spinal cord injury that successful aging involves taking care of physical, emotional, and social health, maintaining as much independence as possible, and being open to changing how to do things when old strategies do not work. And people who engage in self care and in their community maintain a healthy lifestyle, have a positive outlook, and visit their doctors or spinal cord injury specialists regularly are more likely to age successfully. And this is a note of acknowledgement. I'm grateful to Dr. Wilson and Dr. Hensel for their valuable support, exceptional mentorship, and being a source of knowledge for me that guides management of my patients with spinal cord injury. And I really like this quote. This is by Clark Landis. He is serving as an alumnus at University of Washington to wheelchair repair services. And he says that take care. So it was basically, it was an interview with the psychology professor. It was an hour and a half interview with the psychology professor. But I really like the last half and like a minute and a half part of it. And he really goes on saying about aging with spinal cord injury. He says take care of all that you can, because what you can nobody can. So I do want you to listen to this 1.5 minute message by Clark. So we need to wait for just a few more seconds before this ad goes.
So we are not seeing the video and we are already 15 minutes past time. So if we could just wrap up, if you send me this link, I can include it in the email that I'll send out with the recording.
Yeah, can you see now?
No, we still can't see the video. So if
Oh,
we could
okay. So I've already
wrap up.
sent you the slides. So the end part of the slide has the video link, and I'm just figuring out how to be back on my screen here. So can you see it now? Okay. That's all from my side. Thank you all for your attention. If anybody has any questions, please sure go ahead.
I have a question.
Yes, please.
Um, I my level of injury, I'm an incomplete para, is T9, T10, but I am being considered a candidate for the Inspire surgery for those with sleep apnea that they don't have to wear their CPAP. But after listening to all your things you pointed out about pulmonary issues, is that maybe not such a great idea?
So basically, I have seen some of the patients with an implant. that helps them with their sleeping issues,
Mhm.
but it's basically more for patients who are undergoing any surgeries for their hand or shoulder, which they should be considering the level of assistance they might need after the surgery. So I don't think so after like any spinal procedure or any procedure that just is implanting some kind of device, and then you might need to like take rest based on the precautions and the post-operative care recommended by our surgeon. So in general, we expect more rest or need of help in cases where the surgery involves your hand, your extremities, the upper extremities, which are a source of or the main key parts of your body that helps you be independent with your function. So that's where we just give a heads up to also think about the time period where you might need help, but that does not necessarily mean that you should be staying away from surgery. It's just to give you and also a food for thought that this is also the time period you might need to make certain adjustments ahead of time if you are going to be in a period or recovery period where you would be resting, and then you would need somebody to take care of everything you used to do before that for you, yourself, your home, your body. So it was about that. Yeah. I hope that answers his question.
Megan, can I ask her one more question, or do we have to go offline or anything
Um,
since it's overtime?
one more question and then we'll end it.
I've been experiencing urinary tract issues, a urinary tract infection almost since November.
Mhm.
Very few weeks did I not have an infection. Um, but they keep putting me on different antibiotics. I don't want to keep doing that, do I? From what you're mentioning in your slide presentation.
So, so it also depends. Some patients are on very long-term antibiotics just to keep off the symptoms of UTI, because every time they get a UTI, it's infective, which means the organism or the bug there is causing problems. And then if they do not take any treatment for that, it would definitely cause the harm, because that's the pathologic organism rather than just laying there or colonizing that area. It's actually doing harm to the tissues inside. So we need to treat that. And that also, one is if you have an idea when you have a UTI, every time it's symptomatic, which means it needs attention. So there are people who have no symptoms at all, and then if you just randomly check their urine sample, you would have some traces of bacteria or some picture which looks like, oh, that this might be a UTI, but really, clinically, if you assess them, they do not have. But every patient is different, number one. And then every symptom of UTI needs to be carefully assessed before you decide not to treat that. And then thirdly, if the patient is sick, you do need to seek medical attention and based on the risk factors as well. So if somebody has diabetes and the person is old age, the person is also on some other medication that weakens your immunity, for example, is on steroids for some reason. So there are a couple of things that puts you at risk. So sometimes we do not just let it go, and then we carefully assess if this is a real symptom and then if it needs treatment. So it doesn't apply to every single patient, but these are some general concepts and ideas, because every patient who has sometimes positive symptoms of positive like test for urine analysis really makes him or her anxious that, oh, maybe I need to get definitely a treatment. But then it's sometimes if you do not have symptoms, you are not symptomatic. So, based on the recommendation from your clinician, you might not be needing an antibiotic.
Thank you.
You're welcome.
And if anybody has any more questions, feel free to email us and I can get you connected with Dr. Alarabia and find you those answers. But thank you so much for presenting tonight, Dr. Alarabia. That was great. The replay for this will be up this week sometime. I'm not going to make any promises when, but we will send an email out with the slides and the link to the replay so you can go back and review it if you would like to.
Thank you, everyone. It was good to see you all virtually, and it was an honor to present here. Thank you.